So firstly, we would like your consent to videotape this conversation in order to publish it on our website, as well as in order to help other patients experiencing the same condition as you.
You have my consent.
Thank you. So we've known you since March 2018. You have undergone 2 different procedures with Dr. K. How about you guide us through this journey? Like, how did you find us? How did you find out about our technique and Dr. K? What was your main problem and the difficulties you had to face in your everyday activities?
Well, I'm from Pennsylvania, United States, and so my medical treatment for my eye is mostly in Pittsburgh, Pennsylvania. And my problems started really when I was a child in 1974. I was 12 years old, and it was a life-changing event for me because I had the herpes virus in the cornea of my left eye. And I live in a small town in Pennsylvania, and it took a long time to diagnose and a long time to treat. And by the time it was finished, my cornea was severely damaged and my life had changed very much. I grew up most of my life primarily with my right eye, for which I was thankful because I had very good vision with my right eye. My left eye was compromised by the scarring, and I always hoped that someday I could improve it. I had been offered the possibility of a corneal transplant, but I had always been told that if I did that, there would be a chance that the virus would come back and infect the transplant, and then I would have a very serious risk of loss of sight completely. So I waited and always waited and hoped and prayed that someday that there would be an answer. And as the internet came about and as more information became available, I promised myself that on my birthday every year I would spend some time researching what might be possible for my eye. And also every year about the time of my birthday, I would go to my doctor in Pittsburgh and talk to her about the new technology and new possibilities for my eye. Well, on my birthday, as 52 years old, I started to read on the internet, as I always did, and it's difficult for me to understand medical journals because I'm a lawyer by profession. I'm not a doctor, but I did the best I could, and I came across a journal article, and it was an interview of Dr. Kanellopoulos. And in that interview, he was describing a technique, a new type of laser, and a technique by which he was doing some surgery for my type of condition. And I'd never heard of this surgery, but it seemed to me, I couldn't understand it all, but it seemed to me like it might be helpful. The next day I went to my doctor in Pittsburgh, and I had my appointment, and I asked about new technologies, and I tried to describe what I had read about Dr. Kanellopoulos. I didn't say his name, but I described what I had read. And after I described what I had read, my doctor said she had never heard of this, but she didn't think that it would be helpful, but she would try to find out. And then she went on to say that by coincidence, the next day after my appointment, she would be attending a lecture in Pittsburgh, and that lecture would be to do with laser correction to the cornea. And she told me that she was very interested to go to the lecture because the doctor was coming to Pittsburgh the whole way from Greece. And I said, that must be Dr. Kanellopoulos. And she looked at me like, how would you know that? How could you ever know that? And I said, this is the man and this is the procedure that I've been trying to describe to you. And she said to me that if that was the case, that this was meant to be, and she sent me straight down to Pittsburgh testing lab for every test that she could do, and promised me that she would take those tests to the lecture and present them to Dr. Kanellopoulos if she had the chance at the end of the lecture. And so then I heard back that she did present those, and he took them here to Greece and promised that he would look at them and let us know if it could be helpful, if he could help me. Well, several months went by and I hadn't heard anything, and I saw my doctor happened to see my doctor at the grocery store, and she told me that yes, the doctor had contacted her. Dr. Kanellopoulos had said he could help me, but we hadn't been in touch yet. And about a week later in my office, there was a call from Greece, which is very unusual. And it was Flavia here at your office. And she was explaining that Dr. Kanellopoulos could help me. So I was very interested in that. And we set up the appointment in New York City, where the doctor visits several times a year. And I traveled to New York City and eventually had a topography-guided PRK surgery, which was meant to smooth my cornea, smooth the surface of my cornea, and remove as much of the scarring as possible. But the most important thing is that it would normalize and smooth the surface so that I could wear a contact lens and see much better. That surgery was very successful. It took time to heal, but when I had healed from that surgery, months later, I tried a contact lens, the type I had worn before, and at first I read 20/25, which was very good for me, and eventually I read the 20/20 line on the chart, and I was very excited about that. And so I wore a contact lens, but unfortunately, probably because of all the history of my eye, I shortly after that had a floater, cloudy floater in the center of my vitreous, which became so thick that I could not see very well with it, and eventually had to have a vitrectomy, which was successful and removed the floater. But as a result of that, the cataract came to my lens, and then it became a very difficult and complicated question as to what should happen with my implant, my cataract implant procedure. And I consulted my doctor in Pittsburgh, who is also world-renowned, but she told me this is a very complicated procedure to do the implant. And she did not feel that she wanted to do the complicated implant. Thankfully, Dr. Kanellopoulos, when I contacted him, was willing to stay with me and to do everything he could for me. And I sent all of my tests by internet, by email, to this facility, and they were carefully read, and I had long correspondence back and forth by email. But it was very well explained to me that yes, he thought again that he could help me, and that if I would come to Greece, that he could match my implant to my very complicated cornea, the one that he had operated on before. Well, by this point I had great confidence in Dr. Kanellopoulos. Anyone who meets him can see that he takes his time with his patients, and although he's a world-renowned surgeon, he is a very humble and very personable and very caring, and he treats everyone like he would want to be treated. He wants the best outcome and wants to do anything that it takes. So I was willing to come to Greece, which was very expensive for me and a very long trip, but I felt that this is my eye, this is the right person, and I've been led here. I felt that my faith and that all the circumstances had led me here, and that this was the right thing. So several days ago, I had my implant surgery, and he explained to me in a very long appointment. I couldn't believe he gave me so much time and answered all of my questions, but he explained to me what he would do. Told me that there was a very, very high probability that he could correct my vision with the implant and match the lens to my cornea, which by this time I understood was extremely complicated and involved many, many tests. Before the surgery, I came to the clinic for a full afternoon of testing, and I've been going to eye clinics since I was 12 years old. I've never seen technology like you have here. In fact, downstairs it looks like a gymnasium where it would be full of aerobic equipment, but instead of aerobic equipment being packed into the room, there are dozens and dozens of testing equipment, computers and tests. And I went through all of these computers and tests, and when we were all done, I felt confident that all the data that the doctor was looking at was telling us we could be successful. Well, the surgery went very well, I am told, although I'm only 3 days past my surgery. My vision has improved significantly each day, but I'm still hoping it will improve more, and I'm told that it will. Most comforting is that Dr. Kamelopoulos has assured me that if this is not it, if this is not my best vision, that there are more options. He can do another corneal revision, and that he will stay with me and make sure that I get the best vision I can get. And that has been most reassuring, and I feel that he has a personal interest in me. Although it's a big practice and a busy one, I feel like he pays attention to what I need.
Okay, thank you so much for all these kind of words of yours. So, was our team hospitable and courteous during your stay here at LaserVision?
Yes, particularly so. I'm used to American hospitals, which are very good, but very busy, and it's not always the case that everyone has time to know you and to hear you, but everyone here has taken the time to know my name, to understand my needs, and Flavia in particular has always responded to my emails, even though I'm in the United States and she's here, and I know she's busy, but whatever questions I had, she was sure to answer.
Okay. And what advice would you give to patients suffering from a similar condition?
Well, I am so glad that I didn't settle for many of the things that were offered to me that were not as good as this option. It's very hard to know when you're not in the medical world, and even if you are, it's very hard to keep up with the very quickly changing technology that's available for the eye. Much of it is miraculous and very, very advanced, but not all doctors know everything that can be done. The important thing, I think, is to find the best person you can find, and you need to do your research. You need to get on the internet and find out the best people in your field, and then you can be confident that you will get the best technology and the best surgeon. I feel that that's happened partly because I have tried my best to do that, but mostly because I feel like my faith has led me to the right person.
Okay, thank you very much for your testimonial.
You're welcome.